Good afternoon.
Namaste, hello everyone, and hello from India. Welcome to our H5N1 360-degree connecting global expertise with Indian professional webinar series. Thank you very much for your participation today. You have joined our sixth and final webinar and dialogue session focusing on H5N1, building Indians' future preparedness. We will begin our program shortly. I would like to kick off today's program by reminding you of some of the housekeeping items that are listed on the screen. First of all, please turn off your microphone during the session and only unmute when required to speak. Please turn on your camera so that we can see each other. Treat everyone with respect, and if you have any questions or comments, please feel free to message us through the chat box. We will try our best to address your concerns. The chat box is also there for you to introduce yourself. Please mention your name and organization. Last but not least, please avoid phone calls or any disruption during the session. Note that the session is being recorded and streamed live on YouTube. The recording will be available on our YouTube channel immediately after the session. An evaluation shell survey will appear at the end of the session. We would greatly appreciate your feedback as it will help us to improve future sessions. Thank you very much for your attention. And once again, welcome all to the sixth and final webinar of the webinar series organized by Center for Scientific Research and Development, People's University, Bhopal, India, in collaboration with HSC International, USA. My name is Archana, and I'm proud to tell you that I'm a laboratory supporting staff member at the People's University. It is a great honor for me to serve as the MC for this webinar. If anyone has any issue with audio or video, please use the chat box and we will do our best to help you. To start with the session, I would like to invite Honorable Vice Chancellor of People's University, Professor Dr. Harish Rao, to deliver his welcoming and opening remarks. Professor Dr. Harish Rao, please.
Thank you very much. And I would like to greet a very good evening to all the honorable speakers, distinguished panelists, esteemed colleagues, students, and participants. And I'd like to welcome them to all the members and all the participants who have joined us from across the globe. It is with great pleasure that I, on behalf of People's University and the organizing team, extend my heartfelt welcome to this very special and final session of the H5N1 360 degrees webinar series titled H5N1 Building India's Future Preparedness. This series, thoughtfully conceived and implemented under the leadership of the Center for Scientific Research and Development, a constant unit of People's University, in collaboration with HSC International USA, has served as a timely and strategic platform for connecting global expertise with Indian professionals to address one of the most pressing public health concerns of our time, the H5N1 avian influenza virus. Today's session marks the sixth and culminating dialogue in this impactful series. It is without doubt the most pivotal as we stand at the intersection of emerging global health threats and rapid scientific advancement. There is an urgent need to unite cross-border knowledge, foster innovation, and build resilient systems to safeguard a future. We are deeply honored to have with us a distinguished panel of global experts, including Dr. Ashok Mehendale from India, a respected expert in public health and community medicine. Then we have Dr. Noel Miranda from Philippines, Senior Advisor at MNC Center for Research and Innovation, Dr. Himanshu Kumar, Professor in Immunology from ISR Bhopal, Indian Institute of Scientific Education and Research, Bhopal. He is an authority in biological sciences. Dr. Lema P. Haro from the United States, a senior scientist in biosafety and laboratory operations, and Dr. Erin Sorrell, a senior scholar from Johns Hopkins Center for Health Security, USA. Our sincere gratitude also goes to Professor Dr. Subhash J. Bhore, our esteemed colleague and moderator for this session, whose dedication and vision have been instrumental in driving this series forward. This evening, we will delve into critical areas such as advanced biosafety and biosecurity practices, the role of synthetic biology and surveillance technology, and strengthening health systems to build long-term pandemic resilience. This is not merely an academic discussion, it is an action-oriented dialogue aimed at shaping policies, guiding research priorities, and enhancing preparedness efforts not only in India but globally. I'm told that so far we have 918 registered participants from 20 countries, namely from India, Bangladesh, Egypt, Ethiopia, Indonesia, Malaysia, Mexico, Nigeria, Pakistan, Philippines, South Korea, Thailand, Nepal, Iraq, Italy, Jordan, Uganda, UAE, UK, and the USA. Let us seize this opportunity to learn, share, and collaborate. I encourage all participants, students, researchers, and professionals alike to feel free to make it as interactive as possible by engaging actively, asking questions, and carrying forward the insights gained today into your respective domains. Once again, thank you for being part of this vital initiative. I wish you all an enriching and inspiring session ahead. With that, I now declare the session open. Now I will hand it over to our MC, Archana and Neha. Archana and Neha, over to you. Thank you.
Thank you very much, Professor Dr. Harish Rao, for the welcoming and opening remarks. Ladies and gentlemen, this webinar will be moderated by Professor Dr. Subhash Bhore, and it's my privilege to introduce him briefly. Professor Bhore is an educator, researcher, and biological risk management professional with over 25 years of progressive working experience, including more than 17 years in academic session. and over 8 years in biotechnology industry. As an International Federation of Biosafety Association certified professional, he has implemented many biorisk management related programs in Southeast Asian countries. He also served as a subject matter expert and consultant to international development organizations including Civilian Research and Development Foundation, USA, and Health Security Partners, USA, dedicated to building global capacity to improve biosecurity, biosafety, sustainability, and global health security. With this brief introduction, I now invite Professor Bhore to introduce the speaker and panel members and commence the session. Sir, please proceed.
Thank you very much, Ms. Archana. Good evening, good morning, or good afternoon, wherever you are joining from. Welcome to the final session of our H5N1 360-degree webinar series. Over the course of 5 dynamic sessions, we have explored the evolving H5N1 threats from multiple angles. In our previous discussions, we have explored the global context of H5N1 and its current status, highlighting the challenges and gaps in global preparedness. Discussed biosecurity and One Health approach, focusing on how we can integrate human, animal, and environmental health to better respond to zoonotic diseases. We have examined vaccine strategies and explore Indian case studies in pandemic preparedness, drawing key lessons on how the country can strengthen its health system to combat future health crises. As we bring this series of webinars and dialogue sessions to a close, today's session of Building India's Future Preparedness will bring together experts in biosafety, synthetic biology, and One Health, and community medicine to discuss how India can enhance its response capabilities in light of the H5N1 threat. Today's discussion will explore the intersection of global collaboration, health systems, and policy action, with a focus on practical solutions for turning preparedness framework into real-world actions. We will address critical insights into the biosafety, synthetic biology, and how India can build a resilient health system that can effectively respond to H5N1 and similar threats. We are excited to have 2 distinguished speakers who will set the stage for today's discussion. Dr. Ashok Mehendale, ex-professor and head of Department Community Medicine, Datta Meghe Institute of Higher Education and Research, India. Dr. Mehendale is a leader in public health and community medicine. His work has focused on improving health systems, particularly in rural India, and his insights on strengthening India's response capabilities for H5N1 will provide a crucial perspective on the integration of community-based interventions and health system preparedness. Dr. Noel Lee Miranda is our second distinguished speaker. He is a senior advisor and senior research fellow at Ateneo Center of Research and Innovation, Philippines. Noel has extensive experience in One Health and global health collaborations. His research and work in zoonotic diseases and pandemic preparedness have highlighted the importance of cross-border collaboration and the integration of human health and environmental health. His presentation will focus on how we can build effective global frameworks for pandemic preparedness with a focus on H5N1. After the presentations, we will transition into our panel discussion where we will dive deeper into the themes of biosafety, synthetic biology, One Health, and pandemic preparedness. I'm excited to introduce our esteemed panelists whose expertise will help guide our conversation. Dr. Irene Sorrell, Senior Scholar and Associate Professor, John Hopkins Center for Health Security, John Hopkins Bloomberg School of Public Health, USA. Dr. Sorrell is an expert in biosafety and global health security. Her research focuses on pandemic preparedness, biosecurity, and the global implications of emerging infectious diseases. She has been instrumental in shaping policies that ensure safer practices in laboratory environments and public health responses. Dr. Lema P. De Haro, Senior Scientist, Biosafety and Laboratory Operations, Merrick and Company, USA. Dr. De Haro, we can call Lema, brings valuable insight into synthetic biology and biosafety. She has worked on projects related to biosecurity in research labs and the ethical implications of synthetic biology technologies. Her expertise will be critical in discussing how innovative technologies can be applied safely to improve pandemic preparedness. Dr. Himanshu Kumar is Professor and Department Head, Department of Biological Sciences, IISER, Bhopal, India. Dr. Kumar, or we can say Dr. Himanshu, is a leading academic in biological sciences and research in India. He has extensive experience in biotechnology and biosafety, and his work has contributed significantly to understand how scientific research can enhance pandemic preparedness through early detection and global health collaborations. Okay, ladies and gentlemen, with great pleasure, I invite our first speaker, Professor Dr. Mehendale. Dr. Mehendale, over to you. Dr. Mehendale. We can see the slide. You can go ahead, sir.
Yes, sir.
Please go ahead.
On. Am I audible, sir?
Yes, sir. Please go ahead. We can hear you. Please go ahead.
Okay. So a big namaste to all of you. May I start, sir?
Yes, sir. Please go ahead. We can hear you. Please go ahead.
Okay. Audio? Video? Video is on. So coming to India's preparedness for H5N1, the war that never ends. In the context of H5N1, The significant zoonotic threat that all of us are aware. And you can see the case fatality rate of 48.2%, which is quite alarming all over the world. India experienced the sporadic outbreaks with the most recent human case reported in 2025 from coastal Andhra Pradesh. Most human cases had recent exposure to sick or dead poultry. No human to human transmission were, of course, identified. But the zoonotic threat remains elevated due to the spread of viruses amongst birds. Now, what are the WHO steps and monitoring assistance? The global surveillance oversees the global influenza surveillance and response system to track seasonal, zoonotic, and pandemic influenza viruses worldwide. Standard setting develops and disseminates standards for influenza definitions, diagnostics, and reporting. And pandemic preparedness provides strategic guidance and tools like pandemic influenza preparedness framework to help countries prepare influenza pandemics. Vaccine support recommends vaccine strains, support candidates vaccine virus development, and assist with vaccination strategies, especially for at-risk populations. The capacity building offers technical assistance to strengthen national level and surveillance and systems for early detection and response. And zoonotic influenza and RSV monitoring monitors viruses and expands efforts to include other respiratory pathogens like the RSV. Now, coming to the main topic for today, that is India's strategic response to H5N1. Yeah. Vaccine development and collaboration, which is ICMR, that is Indian Council of Medical Research Initiative. In February 2025, the Indian Council of Medical Research issued an expression of interest to develop a human vaccine against H5N1. This move aims to boost India's pandemic preparedness by partnering with eligible public or private organizations for research, development, and commercialization of the vaccine. ICMR also offers technical and regulatory support through its key institutes, the National Institute of Virology at Pune and the National Animal Resource Facility for Biomedical Research at Hyderabad, both equipped with validated H5N1 strains and high containment labs. Partnerships will follow ICMR's technology development collaboration guidelines, offering joint R&D and material transfer agreements. Startups and experienced firms alike are eligible, with equitable IP sharing and revenue models aligned to public health priorities. Through this dual pronged strategy of fostering innovation and institutional partnership, Indian Council of Medical Research aims not only to produce a viable H5N1 vaccine, but also to enhance India's overall capability in responding to future zoonotic threats. Of course, the initiative reflects a broader One Health approach, integrating scientific research, public health preparedness, and intersectoral collaboration to mitigate pandemic risk. One Health program integration. India's response to zoonotic threats like H5N1 is guided by the National One Health Program for Prevention and Control of Zoonosis, NOHP-PCZ. It aims to integrate human, animal, and environmental health systems through intersectoral coordination at all administrative levels. The focus is on building a unified, structured One Health platform to enable joint planning and action across sectors. The Center for One Health at NCDC plays a pivotal role in implementing the One Health approach. It facilitates collaboration among various sectors to address zoonotic diseases. An example of such collaboration is the joint interministerial declaration supporting the elimination of dog-mediated rabies from India by 2030 through the One Health approach. The Division of Epidemiology at National Center for Disease Control is instrumental in enhancing public health capacity. It focuses on strengthening field epidemiology skills among public health professionals and promoting evidence-based responses. The division supports national health programs like the Integrated Disease Surveillance Program, IDSP, the INSACOG, and the Antimicrobial Resistance Program. It also monitors international health regulations in India and prepares technical documents, including guidelines and training material. Now, what is important for the country is the National Institute of One Health, NIOH. The foundation stone for the National Institute of One Health was led by Honorable Prime Minister Narendra Modi on December 11, 2022 at Nagpur. This institute aims to enhance India's preparedness for zoonotic diseases by focusing on the identification of novel and unknown zoonotic agents. The NIOH is being established with PSL 3 and 4 laboratories, enabling high containment research on emerging zoonotic pathogens like H5N1. It aims to serve as a central hub for research, surveillance, and policymaking in the One Health domain, integrating efforts across human, animal, plant, and environmental health sectors. The Institute will also spearhead the National One Health Mission, focusing on integrated disease control and pandemic preparedness. The October 2024 NCDC CD alert outlines critical measures for managing avian influenza, focusing on early detection, strict containment, and robust public health preparedness. The strategies include surveillance and containment, public health response, intersectoral coordination, and public awareness. Strengthening surveillance system is India's integrated disease surveillance program in collaboration with the Indian Epidemic Intelligence Services, IEIS, ensures real-time monitoring of H5N1 in both humans and poultry. This proactive surveillance allows early detection and rapid containment of outbreaks. Training and capacity building of health professionals. National and state level health professionals receive continuous training on diagnosing, managing, and controlling avian influenza. Institutions like ICMR and WHO offer technical guidance, while local health authorities are empowered with knowledge about infection control and preventive measures. Collaborative efforts with veterinary and animal health agencies, partner, partnering with organizations like ICAR and NIHSAD India, integrates animal health surveillance with human health monitoring, ensuring that H5N1 is in poultry is promptly identified with strict protocols for culling and containment. India has also invested in the development and testing of H5N1 diagnostic kits and vaccines, improving self-reliance and ensuring the availability of reliable tools during outbreaks. Institutes like National Institute of Biologicals play a crucial role in the quality control and regulation of these products. Of course, what is most important is public awareness and community engagement. The government has rolled out awareness campaigns targeting vulnerable communities, particularly poultry farmers, educating them about the risks of H5N1 and the necessary precautions to reduce exposure. Now it has become mandatory in the country for registration of poultry farm. All poultry farms, regardless of size, are now required to register with their respective state authorities. This measure aims to enhance national surveillance for early detection of avian influenza outbreaks, standardize biosecurity practices across commercial and backyard poultry units, and facilitate traceability and response coordination during zoonotic threats. supported under India's One Health approach to integrate animal, human, and environmental health monitoring. The National Action Plan 2021, a strategic blueprint to combat avian influenza, the Department of Animal Husbandry and Dairying launched the revised National Action Plan in 2021. Focus areas include prevention, early detection, and containment of avian influenza, special attention to wildlife reserves, sanctuaries, and zoological parks, coordinated multi-sectoral implementation by all states and UTs. Reinforces India's One Health strategy by integrating wildlife health surveillance with public health systems. Heightened wildlife surveillance, proactive monitoring of zoo and sanctuary species, enhanced vigilance in wildlife reserves and zoological parks across India, triggered by H5N1 related deaths in vulnerable species like tigers and leopards. Authorities are also implementing routine sampling and lab testing of avian and mammalian species, strict biosecurity in wildlife enclosures. The goal is early detection, containment, and prevention of interspecies transmission. Public awareness campaigns, empowering communities to prevent avian influenza, targeted outreach to poultry workers, farmers, and rural communities, with emphasis on safe handling of poultry and birds, personal hygiene and protective equipment usage, early symptom recognition and timely reporting, mass media, local health workers, and veterinary services collaborating for widespread sensitization. Goal is to break the transmission chain at the grassroots level. Now, H5N1 diagnostic laboratories and National Influenza Net. Strengthening early detection and rapid response, India's National Influenza Network includes a chain of designated H5N1 labs across regions. These labs operate under ICMR and Ministry of Health and Family Welfare guidance with BSL-3 containment protocols. The key functions of sample collection and real-time RT-PCR testing, viral isolation and genetic sequencing, surveillance support, and outbreak confirmation. Labs coordinate with NCDC and WHO reference labs for validation and data sharing, and regular training and proficiency testing ensures quality and biosafety. Now, I'll just go through the names of the various national institutes which are involved. The National Institute of Biologicals located at Noida, Uttar Pradesh. The National Institute of High Security Animal Diseases located at Bhopal, Madhya Pradesh. It's a World Organization for Animal Health reference laboratory for avian influenza. It conducts surveillance, diagnostic testing, and research on H5N1 in both poultry and wildlife. Indian Council of Medical Research, the National Institute of Virology, Pune, the National Institute of Pathology located in New Delhi, the Indian Council of Agricultural Research under the Directorate of Poultry Research is located in Hyderabad. Its role is responsible for poultry disease research, including H5N1 outbreaks. It focuses on avian influenza and other poultry diseases, studying virus transmission, impact on poultry population, and public health risks. The Central Drugs Standard Control Organization located in New Delhi, the biosafety and biocontainment laboratories which have multiple locations across India. These labs are used for handling high-risk pathogens like H5N1 for research, diagnostics, and vaccine development. They ensure the safe handling and containment of the virus in research settings. The Zoological Survey of India, located in Kolkata, West Bengal. ZSI conducts wildlife surveillance and studies of avian species, tracking the spread of H5N1 in bird populations across India. This is crucial for understanding the potential risk of the virus crossing into mammals and humans. Now, Indian Epidemic Intelligence Services, IEIS, and H5N1 avian influenza. Part of integrated disease surveillance program, operates under Ministry of Health and Family Welfare, Government of India, with the objective to detect, respond, and control epidemic-prone diseases, including H5N1. The key functions are surveillance, that is, early warning systems for human and animal outbreaks, collaboration with ICMR, ICR, WHO, and state health departments, capacity building for local health authorities and lab diagnostics, and public health actions, which includes community engagement on preventive measures, quarantine protocols for humans and animal cases. The role in H5N1 avian influenza is surveillance and monitoring, real-time monitoring of avian influenza in humans and poultry, early detection of potential outbreaks, outbreak investigation with deployment of affected areas for field investigation, sample collection, and contact tracing, identification of sources of outbreak and risk assessments, in response and control by implementing containment measures, culling of infected poultry, quarantine, and movement restrictions, coordinating public health advisories to limit human-to-human transmission. Coordination with National Action Plan for Aviation Influenza, IEIS ensures real-time response aligning with India's National Action Plan for Avian Influenza, focus on preventive and containment strategies to prevent large-scale outbreaks. The impact is rapid detection, containment, and reduced human transmission risk during H5N1 outbreaks, successful collaboration with national and international health agencies to mitigate the impact of the disease. So, to conclude, the take-home message is building a resilient H5N1 response in India means investing in an holistic response consisting of rapid detection, coordinated action, and continuous preparedness, because protecting public health starts with staying one step ahead. Thank you.
Thank you very much, Dr. Mehendale, for that comprehensive overview on strengthening India's H5N1 response capability. Ladies and gentlemen, our next speaker is Dr. Noel Lee Miranda, Senior Advisor and Senior Research Fellow at Antonio Center for Research and Innovation located in the Philippines. He will be presenting on a framework for global collaboration in pandemic preparedness. Dr. Noel, it's my pleasure to invite you to deliver your presentation. Dr. Noel, over to you.
Well, thank you very much for having me here. I think it's wonderful to be sharing with colleagues in this aspect of global health security and One Health. So I'd like to begin my presentation, and maybe later I can respond to certain questions. Thank you very much. So let me just hide the control. Okay. Is my slide moving? Sorry. Yeah, go.
Yeah. Please
So
go.
anyway, I think it's very important for us to look at the whole aspect of IHR. We know that we have IHR 2005. We know that IHR is going to change. It's supposed to be, the new IHR is expected to be imposed or enforced in 2005, which is this year. And we know that IHR is a bit more focused on preparedness and response rather than primary prevention. So a lot of aspects of primary prevention, particularly when it comes to mitigating or preventing climate change impacts or climate change drivers of sustainability or lack of sustainability, or biodiversity loss and ecosystem degradation. That's all what we call upstream, and I'd like to explain that later. But when it comes to IHR, it's a lot of focus, at least the IHR that we have been experiencing and we have been used to is about response and preparedness. So when you look at the whole spectrum of threats and risk, it's really about looking at the upstream and also the downstream. And when we're talking about downstream, as I said, it's preparedness and response. That's here to the right side. But there's also that prevention aspect. And overall preparedness is actually happening across this, very wide spectrum of our focus or challenge, and a lot of problems emerging. And, we need to generate solutions to all of these problems across the spectrum. So prevention of zoonotic spillovers, for example, is really very much focused on risk reduction activities, understanding infection dynamics, addressing the anthropogenic drivers of disease emergence, and integrated surveillance. Then going to the downstream, and very downstream would be I guess the focus of this particular seminar would be diagnostic laboratories, surveillance and epidemiological investigation, healthcare research capacities, R&D, vaccines development and therapeutics, and management of long-term impacts. So those are really when you can no longer, once a disease shifts primarily from human to human, or primarily to human, then it becomes a public health emergency. Whereas in prevention, the disease has not emerged yet. So when we're talking about One Health, for example, a lot of it has to be focused at the local level, right? So that's very important. We have to understand that it's not all national. And what we need to do is we need to have this process that actually, or the mechanism that actually is able to interoperate across the different sectors. And that interoperability is what One Health is all about, that we are able to jointly conduct surveillance, epidemiological investigations, risk assessment, laboratory networking, that cuts across, or that integrates sectoral capacities. Particularly important would be the sharing of information. That should be happening from the local, very local level down to subnational and to national, of course, international, where you have WHO and the world, the WOA, as the final recipient of information or reports. So I'd like to emphasize in this particular forum the importance of a One Health global health security law and framework. Now, you could ask me, do you need a law? Can we make do of a framework or some kind of policy, like perhaps what India has? But regardless, we have to be able to cover all the important aspects, like operationalization framework, a national One Health Council. In my case, I would prefer that there's a council, very high level council, an action plan development that is being driven by this framework, data integration, joint funding, emergency response coordination, One Health integration, and as I said, surveillance, the prevention, ecosystem health, biodiversity, preservation, and sustainable land use. Those are important. Response and mitigation of zoonotic disease spread, risk communication, containment, and community involvement, capacity building, training, community engagement, and then monitoring and evaluation, sustainability that cuts across the spectrum, localized disease risk reduction, and of course, funding One Health initiatives. So we need to build the long-term response capacity. Now, I'll focus on the downstream, and here we have to invest in health workforce development, strengthening detection, early warning, and rapid response systems, particularly the 717 framework. Now, I hope you all are aware of the 717 framework, and institutionalized simulation exercises and after-action reviews. I think there's a tendency for us to actually not do after-action reviews, but actually it's very important because you actually have to do after-action reviews whenever there are actions being implemented. And as soon as you can review these actions, the better we can learn immediately from the different perhaps gaps that we can uncover, and as well as document best practices. So secure sustainable financing for preparedness, that's also a very, very important aspect of response capacity. Now, documenting One Health outcomes is also very important. The question that we need to ask is, what are we achieving? Okay, one, do we have a One Health governance and coordination mechanism? Number two, costed or funded One Health operational plans. These are upstream and downstream. Improved capacity for data generation, sharing, use in disease management, and decision-making. Training programs and planning workshops for stakeholders and One Health councils. Engaging the community and stakeholders, and community behavior change, mobilization of corporate support, public-private partnerships, capacities, mechanisms, SOPs, policies, guidelines, and non-health outcomes. We have to also be able to achieve them, securing livelihoods, business activities, ecosystem protection. So in the future, in the near future, I hope that we need to build a resilient future together. So this is a call for massive collaboration. We need stakeholders to be able to be contributing to global health and sustainability by investing time, effort, and money in One Health initiatives. What are the impacts if we are able to collaborate and make that collaboration expand across different sectors, not just across the different health sectors, but including the non-health sectors? So we have better understanding, prediction, and prevention and mitigation of future threats. So we need to link One Health to a sustainable life and planetary survival concept. So managing infectious disease emergence, I'd like to share this concept of managing infectious disease emergence footprints through One Health. And this means, for example, climate change is a shared and urgent challenge in this aspect. So stakeholders must step up by offsetting infectious disease emergence through driving One Health solutions and innovation. So maybe this is the first time you've heard of EDE footprints, but certainly we know that this is also human-driven, right? Human activity-driven. Of course, collaborating with government and the academe to generate knowledge, outreach, and nature restoration. So industries can turn infectious disease emergence footprints into solutions that protect ecosystems. So of course, let's just simplify. EDE footprints equals climate change, biodiversity loss, ecosystem degradation. That's more, as I said, upstream. But everything starts upstream. So look at this. There are 70 response options to interconnect the environmental, social, and economic crises. But if you look at this, I have encircled where One Health actually is mentioned. So One Health approach is mentioned here. But if I were to ask you, is this enough to mention One Health here where it says manage risk? But if you were to ask me, I would actually put One Health at the center, where you have One Health response options. And if you look at these options, you have managing the ecosystem functions, consume sustainably, reduce pollution, ensure rights and equity, align financing, restore ecosystems. All of those are actually One Health concern, and One Health can actually work for all of these areas. So regional international collaboration is important. And I think I need to focus on this because I'm also, in a way, supporting ASEAN in some aspects of my work. So we need to engage the regional organizations, including, of course, the quadripartite, and participate actively in global health security agenda, strengthen regional centers of excellence, develop regional surge capacities and shared resource pools, and foster South-South cooperation and knowledge exchange. And if you can do that, for example, within SARC, across, and India would definitely serve as a good leader in the region where we can foster South-South cooperation. But I think what's important here is that we're really doing this kind of very strategic approach to regional capacity strengthening. And I mentioned here regional centers of excellence because regional centers of excellence are actually made up of excellent centers of excellence in the various countries in the region. And if you can put them together and make them work together, share best practices, and as well as share challenges and gaps, looking at opportunities, then we can operate as a region rather than in isolation as independent countries. So I'd like to end my presentation at this stage. Thank you very much for the collaboration. Thank you.
Thank you, Dr. Noel, for that insightful presentation. Your perspective on framework for global collaboration in pandemic preparedness is truly valuable. Okay, ladies and gentlemen, let's begin with a question that ties into both presentations. H5N1 preparedness is a global challenge. I hope you will agree with me. The first question is for all the panelists. Question is, how can countries like India integrate global frameworks for pandemic preparedness with local health systems, especially in the face of emerging threats like H5N1? So anybody can start. So this question is for all the panel members, please. Maybe Irene, you want to start?
Sure, I'd be happy to. Echoing many of the fantastic comments by our speakers, I think, international collaboration is key. Pandemics are a global challenge, and I think we've all lived through at least one major outbreak or pandemic, so we don't need reminders of the way that our world changes, both from a public health, environmental health, animal health perspective. So engaging various regional and global surveillance systems through WHO, through WOA, through the quadripartite, I think are absolutely critical. One of the challenges is that global guidance tends to be intentionally vague. So it can be applicable across a number of member states. So I think being able to address evidence-based gaps and fill those gaps with local and regional expertise, experiences, will really improve both, I think, national and regional approaches to pandemic preparedness. And that's something that I think India can absolutely take a lead on. Over.
Yeah, thank you, Irene. Lema?
Good morning, everyone. Thank you for having me. I will add that there needs to be institutional alignment and policy harmonization with global policy, as well as national and state and local policies to make sure that everyone is in sync. It sounds like already India is doing a lot to strengthen their surveillance and early warning detection systems. I would encourage you to take advantage of AI and how that can be leveraged to make your early warning detection system stronger. there's a few tools that have come up. You can use digital health platforms and vaccination logistics tools. You also need to improve or work on local capacity building and workforce readiness, which has been shown to be a consistent barrier for integrating local and national and international frameworks at the boots on the ground level. Let's also consider vaccine equity and more access to vaccines as a way to prevent the disease from spreading. And I also want to highlight that India is one of the leaders for vaccine research and development. So you should leverage that power that you already have as a country and coordinate a resilient preparedness strategy for vaccine development and deployment.
Okay, thank you, Lema. Dr. Noel, Noel, you want to add anything? Yeah.
Yeah, I'll add. I think a lot has been said, but I would look at, it's not so much the country that should adjust to the region. It's the region that should adjust to countries. And I think it's important to look at this as a leveraging kind of cooperation. We need to leverage each other. Okay, the region cannot function effectively if countries are fragmented, if there's fragmentation. And so countries need to also look at what the region is doing, because it's a lot to do with policies, agreements, treaties. We're full of treaties, and hopefully it can impact on the local communities. But this calls for sensitivity. We need to be sensitive to what's happening on the ground, as well as how we can a lot of political considerations when it comes to global level discussions. So we need to balance. We need to balance, leverage, and increase that kind of sensitivity. Thank you.
Okay. Thank you, Noel. Dr. Himanshu, you want to add anything?
Hi, thank you. Thank you for having me in this meeting. So, most of things are told by these esteemed speakers and Lyman and Noel. Here, I would like to add that, okay, besides this thing, what Noel said, one very important point which in this discussion was missing, the funding. So all these things need a tremendous fund, and that fund should come from everyone. It from different countries, different healthcare system, different partners, and all those things. Because when the fund will be there, then automatically several things will be in place. For example, making a vaccine. So I'm a researcher in the influenza. I do research with influenza virus from last 15 years. Okay. So one very big challenge with influenza virus is that they keep changing. And now we have seen, after seeing this COVID, now we have a better options. For example, mRNA vaccine and other things. So in order to drive all those things and in order to make everything is flowing and more practical and applicable, there should be a very good provision of pouring fund for this work. And that will really accelerate and that will really prepare the country, nations, or internationally. So this I want to add it. Thank you.
Yeah. Thank you, Dr. Himanshu. Dr. Mehendale, you want to add anything quickly?
Yes, sir. Yes, sir.
Yeah, please go ahead.
You see, India can integrate global frameworks like the WHO's internal health regulations by strengthening its national health emergency plans and aligning them with global standards. Now, this includes improving the Integrated Disease Surveillance Program, IDSP, building lab capacity for zoonotic diseases, training frontline workers in One Health approach, and ensuring timely data sharing with global health bodies. Thank you.
Yeah, thank you very much, Dr. Mehendale. Okay, ladies and gentlemen, let's move on. So the next three questions are specifically for Irene and Lema. So in the context of advancing research on high-risk pathogens like H5N1, what steps should countries like India take to ensure that biosafety protocols are robust enough to support innovation in areas like synthetic biology and vaccine development? Yeah, please go ahead. Either one, please go ahead. Okay, Irene, please.
I was going to say, I think Lima is unmuted, so Lima, please go ahead first.
Yeah, please go ahead.
Okay.
Yeah.
Okay, for this question, I would like everyone to reframe their mind a little bit, because I will talk about biosecurity, but not farm and border biosecurity, but more laboratory and data biosecurity. So I want to talk about, first, there's some new pressing concerns, because there's new technology that has been advancing in synthetic biology and also in combination with AI that could have potential for example, reconstructing enhanced pathogens of high consequence in the laboratory. And there's been a few examples that have already been published in the literature. There was a group that reconstructed horsepox and smallpox like viruses, just as a proof of concept that it could be done. It is also possible now with advances in CRISPR technology, synthetic biology, and with the help of AI to also enhance the virulence and the transmissibility of already existing pathogens, what could be called gain of function. This is particularly concerning with H5N1. And also there's a third concern, which is you could combine different virulence factors from different pathogens into one novel pathogen that doesn't exist currently, that could have unpredictable behaviors. That is under the concern of reconstructing or enhancing pathogens. Then there's another concern, which is now with more access to data and AI, we can also democratize dual use risks. What do I mean by that is that the costs now have decreased enough that non-experts, non-scientists, or non-state actors could have access to synthetic biology tools where they could reconstruct these pathogens or organisms that I've just described previously, that could have dual use, meaning they could intentionally use it to cause harm to other people or other countries or other groups. The third concern is that there's a gap in oversight and global coordination. So there's many countries that are lacking binding regulations or laws in synthetic biology tools or the use of synthetic biology, and even further now extended to artificial intelligence. And then there's a lot of biosecurity oversight guidances and mechanisms that are outdated now, that because they're mostly focused on the pathogen rather than the functionalities of the capabilities of these potentially new pathogens. And then all of the international norms are lagging behind. The technology is just developing too quickly, and it can't keep up with the pace of innovation. So we need to create new regulatory boundaries globally and locally that we can all agree to follow simultaneously. How can we prevent some of this misuse? There could be technological safeguards such as DNA synthesis screening for the synthesis companies that you can order DNA from. You can have secure by design principles where you can, for example, design a kill switch for an organism. So if it leaves the lab and it goes into a more wild environment, it would automatically not survive. This is for the people that are doing this research for valid scientific purposes, and they just want to build in safety measures in case there was an accidental release or escape. But we also need to strengthen the global governance frameworks and at the national levels as well. And I would recommend that we need to have digital surveillance and use the tools of artificial intelligence, for example, to our advantage. I will stop it at that. And of course, I think we all agree here, we need to continue to have the One Health frame of mind for all of this because we're in it together.
Yeah, Irene, you want to add anything?
Yes, thank you. Just to add on to that, I think policies are always going to be slower than innovation. Yes, and so if we think about how we discuss and identify policies and develop guidelines, how we inform approaches to research, to technology, to advances, we need to educate new players on that landscape, right? So the way that we have developed advances in biology in the past, we have different players at the table now, and we need to make sure that they're incorporated. Individuals that have, for example, expertise in AI, artificial intelligence, not avian influenza, and in other platforms that may not have been incorporated traditionally in, let's say, advances in molecular biology, incorporate them into these conversations and think about how to get the best informed risk-based assessments and approaches to policy, I think is something that is critical in terms of moving forward. And then when we think about pandemic preparedness and either looking at advancements in diagnostics, in medical countermeasures, or just basic research to really be able to understand host pathogen and environmental interactions, there is a lot that we can do with lower virulent strains and do some preliminary studies and then be able to take the next steps on the potential target pathogens if they are of higher virulence, for example, for high path H5. And there's a lot of lessons that can be applied from other pandemic preparedness response and research platforms, as previous speakers have mentioned, incorporating regional approaches to local levels, sharing resources, sharing SOPs, I think is critical so that we don't, duplicate efforts. Over.
Yeah. Okay, the next question is how can India foster safe research practices while still encouraging breakthroughs in pandemic preparedness? So either one can jump in and share your thoughts. Please go ahead. Lema or Irene, please go ahead. These are specific questions for you.
Yeah, no, happy to start. I think not to sound like a broken record here, but I think as India looks at advancing science and technology, it's really looking at almost revisiting who the partners are and who is informing that science and technology. And so in other, let's say, traditional One Health approaches, we look at stakeholder mapping or partner mapping to figure out who are the players that look at detection, surveillance, reporting, and response. I think that type of approach can be taken for both research and technology and advancements in research and technology, and looking at the diverse players and the expertise that exists in India, and revisiting those initial conversations to make sure that the appropriate partners and information is at the table to consider advancements for India and for the region.
Okay, sounds great. Lema?
I will add that it looks like India's already working on this, but continue to strengthen your national biosafety and biosecurity governance and coordination at the country level. I would advise you to look at upgrading your high containment laboratory infrastructure for your research, especially the BSL-4 and BSL-3 and BSL-4 lab facilities. As Aaron mentioned earlier, invest in maybe regional biocontainment hubs where you can provide access for research, but also training and awareness for the scientists that are working on these problems, including maybe instituting a lab accreditation system that could be unique to you. and work on institutionalizing maybe safety by design guidelines in your research pipelines. And then, of course, train the biosafety workforce, biosafety and biosecurity, your boots on the ground personnel. And I would say also work on fostering public trust. I'm not saying that it doesn't already exist, but it's something that needs to be ongoing. I believe maybe Dr. Miranda mentioned this earlier. Just make sure we do a lot of outreach, education, and information sharing with the general public so that we can foster a culture of trust in the scientific community, which in the past has been a barrier for our previous pandemic response.
Yeah, to just follow up, Lema, are there lessons that India can learn from the US or other countries with established biosafety regulations in their research systems?
Well, in the US, biosafety and biosecurity is not really regulated. It's more of a guidance documents. With a few exceptions, the United States has the Federal Select Agent Program, FSAP for short, that regulates a small number of agents and toxins. So laboratories that work with those agents or toxins must be certified and inspected regularly. And if they don't meet the requirements or the prerequisites, they may have their license revoked, and they would not be allowed to continue work with these agents. But one of the limitations of that program is that it's a small, limited list of agents. So for example, hantavirus is not included in that list. A hantavirus is a virus that is endemic in the southwest of the United States. It's a respiratory virus. It hasn't been deemed to have high pandemic potential, but it still could have some risk. So if you have a scientist or a group of scientists that are working on that agent, they do not fall under the Federal Select Agent Program, which has these more strict biosecurity and biosafety guidelines that must be met. In general, otherwise, if you're a university, a startup company, a biotechnology company, the biosafety and biosecurity are guidelines, so you're not obligated to follow them. They are a best practice, but there's no legal enforcement of them. In my opinion, this is a weakness, but it is how it has been developed in the US. It creates some loopholes and vulnerabilities that we might have to address in the future if something arises.
Okay, Irene, you want to add anything?
I think only to add that, from a university research institution perspective, there are environmental and health and safety offices that oversee biosafety, biosecurity for laboratories, for research institutions. And so I would say any facility that is doing any type of basic research that has funding from government agencies, private foundations, most likely are compliant with the biosafety, biosecurity standards, or else they would not be able to receive funding. So while there aren't necessarily legal regulatory requirements, there is a standard of research compliance that requires that biosafety, biosecurity be both implemented, assessed, and reviewed and revised on a regular basis.
Okay, thank you, Irene. The next three questions are specific for you only, Dr. Irene. So, with your expertise in biosafety and global health security, what do you think are the critical biosafety measures that need to be prioritized globally, especially for countries like India, to mitigate the risks associated with emerging diseases like H5N1? Please go ahead.
Thank you. if we think about and we put in the context of H5, particularly this current outbreak that has impacted a number of species, both avian and mammalian, we know traditional biosecurity measures are effective, right? We know the risks to introduction for a farm, our people, our trucks, their wild birds, and there are steps that we can take to mitigate those risks. There's traditional agricultural biosafety practices that can be put into place. And then good biosafety practices like access and proper use of PPE, good infection prevention control practices. So I think there's a lot that we can pull on from previous outbreaks that can be applied both in India and across the globe. But the key thing that I think has been lacking in this response is integration. And that's something that I think all of the speakers and panelists have approached in some way, shape, or form, is this One Health approach. So it's not just that intersection of animal and human health, but it's also environmental drivers that are impacting disease emergence, disease spread, and challenges with containment. So thinking about how we integrate livestock, companion animals, public health, and environmental health together, to consider these drivers, to consider the challenges for containment and the challenges to response, I think are critical moving forward, both for H5 and other emerging threats.
Yeah, excellent. In your experience, there are often challenges in aligning global biosafety standards with local health infrastructures. So from that perspective, how can India improve its biosafety protocols in research labs to ensure safe handling of high-risk pathogens like H5N1 while still enabling the development of vaccine technologies?
Great question. I think, as I mentioned with an earlier comment, a lot of times global frameworks are vague in their guidelines for implementation, and they're intentionally vague so that member states can adapt based on local resources, infrastructure. And so sometimes that becomes a challenge, is understanding and identifying the ways that you can implement these standards and guidelines at the local level, right? Or as appropriate in your context. And so I think relying on and engaging both national and regional biosafety associations, international and global biosafety associations to look at how to assess your facilities to identify risks for potential issues in biosafety, biosecurity, and then developing approaches that are sustainable, that can align with available funding, available political will, and available resources is critical. There's like a lot, as I mentioned earlier, that can be done at lower containment to respond to different disease threats. And so as much as we can do to balance some of the baseline or foundational work at lower biosafety levels, I think is critical. And then that allows you to take time to plan, to train, to simulate exercises and research that would need to be done at a higher containment to make sure you have the protocols and the systems in place to be as safe and secure as possible.
To follow up with this one, Erin, given the global nature of pandemic preparedness, how do you see the role of international collaboration in enhancing biosafety standards? And from your expert perspective, what steps India should take to engage with international bodies to enhance biosafety in research and public health systems?
Really important question. I think that international collaboration is absolutely crucial. No one can do this alone, and no country can do it in isolation. And so I think India can be a leader, both in terms of its position in basic science and in the development of medical countermeasures to really inform the narrative, share experiences, share results, and encourage a platform for better information exchange, reporting, and collaboration. I think without that, we operate in these silos. We either duplicate efforts, or we're not able to build on previous work and lead to quicker and more productive advancements in science. So I think using international stage and global collaborations to promote work, to build better collaborations, and to identify needs both from a local, regional, and international perspective, I think are critical. So use those platforms and use those frameworks for what they were developed for, and really look at a collaborative approach.
Okay, excellent. Lema, there are a few specific questions to you from the audience. So the first question is, with synthetic biology advancing rapidly, what are the most pressing biosecurity concerns regarding the potential for synthetic biology to create new pathogens or manipulate existing ones? And how can we prevent the misuse of these technologies, especially in emerging diseases like H5N1? Lema, please go ahead.
Yeah, I think the two most pressing ones are the accessibility to gene synthesis, either through a company or through a gene synthesis machine where you can synthesize your own genes. These machines used to be really expensive, but now the price has dropped and it's become more accessible. The gene synthesis companies, they sort of self-regulate. There's no actual legally binding regulation that they must follow. They've created a consortium and a list of best practices that they voluntarily agreed to follow. But there are other gene synthesis companies that do not belong to the consortium, and they haven't necessarily agreed to follow these gene screening practices. So what that means is someone could potentially attempt to synthesize parts of H5N1 or all of it in different parts and put it together in the laboratory. And the technology has advanced so quickly that these procedures that used to take maybe 5 years of training, extremely good lab hands, can now be done by someone who's relatively inexpert, not an expert, a novice in doing cloning, for example. So that's one concern. And then that is augmented by the addition of artificial intelligence tools that can help a novice person or a non-scientific group target specific amino acids or specific regions of a virus for enhancement of pathogenicity. I have to say, to present time, to the best of my knowledge, the publicly available artificial intelligence systems that you might be aware of, such as Perplexity, ChatGPT, and these other large language models, they do not have this capability, but it is possible to create your own large language model system in-house if you have the coding knowledge enough, and that it's only a matter of time before that happens. And the artificial intelligence field is moving very quickly. It's advancing very rapidly. So we are looking at a horizon time of weeks to months, not years. So I don't want to exaggerate the risk. I'm not necessarily sure that it's a very high risk, but we should be aware that the risk is there and it could be exploited by someone with intentions to harm. So I don't think that we will ever fully eliminate the risk. If any of us have ever worked in biosafety or biosecurity, we know that we can never bring the risk to zero when you're inherently working in this area, but we can try to mitigate the risks. And how do we do that? We can implement risk assessment systems, for example, at our local institutions to assess the work that the scientists are doing and see the likelihood of something negative happening. That can be done through institutional biosafety committees, such as Dr. Sorrell alluded to earlier. They're very common in the United States, but I know that they're common throughout the world. So assessing the risks, educating the scientists, because sometimes the scientists themselves are too focused on their own research, their own area of research, the question that they want to pose, and sometimes they don't really intentionally think about the possible side effects or off-target effects that their research might have. So they could use the help from a committee that can help them assess that, for example.
Okay, so it sounds like we must have a system to mitigate the risk. So from that perspective, what regulatory frameworks do you believe are needed to ensure that synthetic biology is used safely, particularly in response to the global health threats? And how can countries like India develop effective regulatory policies for synthetic biology without stifling innovation in pandemic preparedness? Lema.
Yes, and also I would add we want to keep in mind access to and equitable access to the technology, right? We don't want to say, oh, this technology is too advanced, we will keep it from these countries, right? I believe strongly that we all should benefit from these technological advances, which are really quite magnificent. But we just need to do it cautiously. So in my opinion, it needs to be risk-based assessment all the way. So establish general frameworks that are vague enough that allow flexibility so that they're not too stringent, and then base it on a risk assessment framework so that each individual research would be assessed either at the local institutional level, and then you can establish a tiered approach where you can say, okay, these level of types of research can be assessed at the local institutional level, and then maybe we will establish a national ethics committee composed of scientists, for example, and then we can bring it up to a more local level, maybe at the state level, and then at a more national level if the research is deemed to be more potentially risky. This is similar to how the US handles recombinant DNA research reviews at the academic institutions. There are certain categories of experiments that are reviewed by the local institutional biosafety committee, and then if the experiments meet certain qualities or qualifications, then they're brought up to higher levels of committees until you get to the top level, where the committees could decide that we will not engage in these experiments. You can put a stop to them. Of course, that comes with the funding, right? Because as I mentioned earlier, in the United States, there's no legal requirement. So if the committee were to say, no, you can't do this research, and somebody could say, oh, well, I will do it anyway, then you could say, well, we will withhold the funds, right? That is something that India could look at and borrow or let yourselves be inspired by the aspects of it that work for you culturally and as a country and within your levels of resources. Take what works and leave what doesn't work for you. Maybe you might want something more stringent, maybe you might want something less stringent.
Oh, sounds great. I want to highlight, just to let the participants know, because India is rapidly growing hub for the biotechnology research. And Indian government is looking at biotechnology as a growth engine, especially for the economic growth. So as an expert, what do you see as the biggest challenge in balancing innovation and safety in synthetic biology research within India's context as an expert, and how can the country ensure that biosafety protocols are integrated into new biotechnological developments? Lema.
Yeah, the risk in general, I think, is not unique to India, is that the technologists will always be progressing way faster than any policies or guidelines that we have in place, as Aaron mentioned earlier, right? So ideally, what we would like to do is develop policies that are able to move with the technology, or that are forward thinking enough that in 5 years they won't be completely outdated, and then you have to go back to the drawing board, think of new policies, and get agreement from everyone. And that requires thinking outside the box, as we like to say in the United States, right? Different types of thinking. And what that looks like now is, I would say, in general, we don't know, because we are evolving as we speak with the technology. But I would say definitely you can invest in robust training and education programs for everyone involved, not just the researchers, but your compliance experts, your biosafety and biosecurity personnel that are working on site, boots on the ground at the universities. You can consider more robust degree programs or education certificate programs for biosafety and biosecurity within general university education for scientists, so that it's built into the culture of science and research, that we will be safe and we will do science in a secure manner. Many times in my own personal experience as a practicing biosafety and biosecurity officer, the scientists sometimes view safety or biosafety as an obstacle in the way of research. So, you're making me do this safely, and therefore you're delaying me. Or you're making this too expensive for me. You're making me buy this extra PPE. You're making me do these things that I was not used to doing before. Why do I have to wear gloves now when I never wore gloves before? Why do I have to wear a respirator now when I never did it before? Or maybe I don't have the money to wear the respirator, right? So that will take time, but it's important to continue to strive to improve the culture, to say we need to conduct the research safely, right? Waste management too at institutions. I don't know specifically in India, but I know in other regions where waste management can be difficult because of resources, or because of the regulatory framework of the country or the region. So it's important to look at that too. Sometimes people think because it's synthetic biology, it's not a pathogen necessarily, it's not alive, or it's not a harmful chemical, so they don't think much of it. I would encourage you to think otherwise, at least have some minimum measurements in place of autoclaving or disinfecting with chlorine, or, some basic level of waste management for synthetic biology experiments that are not just discarding into the regular waste stream.
Yeah, thank you very much, Lema. It was a wonderful insight. Before I move forward, Irene, would you like to add anything?
No, thank you so much.
Okay, so let's go ahead. So now I just want to turn to Dr. Himanshu. Dr. Himanshu, as an academic leader in biological sciences, what role do you see academic institutions in India playing in enhancing the country's pandemic preparedness, particularly for diseases like H5N1? What kind of research should be prioritized in the next 5 years to strengthen India's health systems? Dr. Himanshu.
Yeah, sure. Thank you. So before going to my question, precise question, I would like to put a light on a previous discussion that Indian institution, for example, my institution, Institute of Science, Education and Research, we have a perfect institutional biosafety committee, which overlook all this thing, whatever we are cloning and all those things. So everything should pass through this committee, and this committee assess all those risk and all other aspects. And then once it will be passed from this IBSC committee, then this project will be funded. Okay, so here just I wanted to put a light on that in context of Indian scenario. Now I will come to my question. So academics is pivotal in all aspects, whether you talk about the educating primary health center, educating the people how to handle the handle during the pandemic, as we have learned in recent past that during COVID. So this all basic education is needed for all kinds of people who are not even a scientist, who don't know science, how to keep all these things. So academics plays a very important role. Now let's move to the upstairs. Let's move to the scientific field. So as you all know very well that India is a global leader in the vaccine production, right? So all these things comes from basic research. So basic research is pivotal in making all those things. Basic understanding of host pathogen interaction or host virus interaction is most important. If we understand, then we can design the vaccine, therapeutic, diagnostic. So all those things are based on the academics. And Indian academic institution, for example, my institution, we have a really state of art facility to conduct these kind of research. We also collaborate internationally. For example, myself, I work with Nipah virus, some aspects of Nipah virus, and I collaborate with French people who has a BSL-4 facility. And I also collaborate with NIV. I'm trying to make an attempt that we can do some basic experiments in NIV in order to get the fundamental results. So I'm a fundamental immunologist, and focus is the host pathogen interaction. So academics is a pivotal for everything from vaccine, therapeutic, diagnostic, and the most important thing nowadays the research is more interdisciplinary, as other people said very clearly and boldly that now there is a new innovation, new technologies are there. For example, AI and other things. So we need all those group of people who can fight against these kind of pandemic. They can design a strategy. They can find out the any outbreak and all those things with the help of biological researchers and computational biologists, computer engineers. So and we need all those people in order to tackle such kind of situation. Yeah.
Okay, Dr. Himanshu, given your academic background, how can India's research institutions collaborate with global health networks to enhance zoonotic disease surveillance and early detection systems? And what lessons can India learn from other countries in terms of research collaboration during past pandemics?
So as you, I think one of the speaker mentioned, Dr. Ashok, yeah, if I remember correctly, he mentioned one institution which is in the Bhopal. So I know very well about the Bhopal NIHSAD. So NIHSAD has a surveillance system. They do the surveillance all over the country, and they also share the information with One Health program, and in that way we can really make all efforts to contain. If some outbreak will happen, this can be easily contained, and this information can also spread other parts of the world, and then there will be a appropriate measures can be developed in order to stop the spread, or to change epidemic or to the pandemic situation. So I think this is very much important. And many institutions, NIV, NIHSAD, all those, and several ICMR institutions, they are working together. So in that way, Indian institution can play a very important role, and they can collaborate. Of course, they are collaborating.
Okay, excellent. Uh, One of the challenge is translating scientific research into policy actions. I think you will agree with me. So from this perspective, the question is, in your, opinion or from your experience, how can India better integrate scientific research into national health policies, particularly those related to One Health and pandemic preparedness? And on top of that, what framework can be put in place to ensure that research directly informs health system responses to H5N1? Dr. Imanshu.
Yeah, so this is very important. So in this aspect, there is a so far I have talked about the interdisciplinary research. Research will produce new product. With new innovation, we can run fast and control the disease. Here I would like to say that there should be a very good integration between the scientific and local health policies, for example, local hospital, local government, and this should be they should be well connected. The scientific people, or the people who are involved in the research, they can predict and they can explain, okay, this is the potential risk. Okay, and there should be a very clear communication with the government, local government, and national government. And in that way, this can turn to a important policy, and when this policy will be in place, then everything can be well taken care. So once this government will involve in making this policy along with the scientists, then they can make a program which can or program or workshop which will be very important for non-scientist or primary healthcare people or common citizen of the country to educate about this kind of risk and the protocol and all basic practices. If something happens, then this can be taken care. Yeah.
Yeah, thank you very much, Dr. Himanshu, for sharing your insights. We got many insights from your answers. So now I have a couple of questions to Dr. Noel. Dr. Noel, with your expertise in global health frameworks, can you share your thoughts with us on how can India expand its role in global health networks for pandemic preparedness, especially in areas like zoonotic diseases surveillance and early detection? Noel.
Yeah, it's a nice question, and from the perspective of India, I think India has a big kind of, I would say, responsibility, considering your level of advancement and level of capacity in comparison to other countries. Of course, there are other countries within your region, within your region, and you kind of share this region with several other countries. But I know India is one of the prominent members of your region, and so you have a responsibility. So and I would say a strong position to lead, and I would lead in accordance to how other regions are doing it. Like for example, ASEAN. That's the region that I'm in, um, where you're actually looking at, of course, the WHO guidelines, for example, and IHR. IHR will become new. So it's important for India to lead and set the example, and be able to harness collaboration towards building regional capacities that actually align with IHR core capacities. So I would say, you have to show example like JEE, for example, Joint External Evaluation. Maybe India is actually, has stayed away from doing its JEE, but JE, I think, is a very important assessment, which actually happens every 4 to 5 years, for example. I think all countries should do it. But I also would like to see that the WHO is adjusting the JEE tool on a very regular basis, particularly with the new IHR and also the pandemic treaty. So I would just sum it up with the suggestion that India should assert its leadership, and this is not by choice, but it is really how you are already positioned to actually provide that leadership and be able to work in building centers of excellence, which you have already done. I mean, you have, strong centers within India, and I think that can be regional centers of excellence. Um, and you can also look at also maybe besides biosecurity and biosafety, I would like to mention, health and climate change, and how One Health can actually be important in providing or driving or delivering solutions to many issues across the spectrum of health threats and health risk emergence. Thank you.
Okay, thank you, Noel. So, I mean, next question is, what role can India play in shaping global frameworks for better cross-border health
Yeah.
cooperation? Because I mean, you are expert in this area, so we would love to hear your thoughts. Noel,
I
please.
I
Yeah.
I think I would rather say that where do we focus, right? Where do we focus? The 717 I mentioned. Uh, India should the region should work together to actually ensure that we're ready to meet the target of 717, which is being able to detect a threat or an outbreak within 7 days, and being able to report that detection in one day, and being able to mount or early response, initiate response within the 7 days that will ensue. So 717, and I think we should work within that framework, and how to build the capacity. And what are those capacities? Of course, detect, uh, information sharing, information dissemination, maybe information technology is important, and response. Response is particularly focused on early response. And when you say response, of course, you have the workforce development, because you cannot respond without the workforce, and surveillance. Sorry, yeah, continuing epidemiological investigation, risk assessment, and risk communication and community engagement. So this response here is actually about mitigation. It's about mitigation, control, containment, and mitigation. And I would say, of course, the other one is detecting, which is surveillance and laboratory capacities. Thank you.
Okay, so thank you very much, Noel, for sharing your insights. So, okay, ladies and gentlemen, we are running out of time. But before I end this dialogue session, I really want to ask couple of questions to all the panel members, because there are many questions, but I want to complete these two questions. Okay, so this one is for all the panel members. I invite all panel members, just jump in and share your thoughts. So the first question is, what are the most immediate steps India can take to strengthen its pandemic preparedness, while also engaging in global partnership for better pandemic response? So anybody can jump in and can start. Maybe Irene, you can start. Okay.
Sure, happy to, and I'll be brief. I think my top recommendation would be integration, thinking about bringing the right players to the table for India, and having conversations about how to improve on surveillance, detection and response, and integrated reporting and information sharing in real time, I think is critical. And then being an example to the world on how to do that would be my recommendation.
Excellent. Lema?
In addition to what Aaron said, I would say leverage your vaccine manufacturing capacity.
Okay, excellent. Dr. Himanshu?
Right. So yeah, as Lema said, that we have a very good vaccine building capacity. So we should keep this thing and innovate in that thing so that we can rapidly fulfill the requirement of the country.
Wonderful. Dr. Noel, you want to add anything?
Yeah, I just want to say very briefly, India should set a good example for global health security and One Health governance. And that means it's formal, it's sustainable, and it's cut across all the sectors, not just the health sector, including the non-health sectors. Thank you.
Okay, excellent. Dr. Mehendale, you want to add anything?
Yes, sir.
Yeah, please go ahead.
See, partnering with international bodies like CEPI and GIS AID, particularly for vaccine and genomic data sharing. That is something which I would like to add. Thank you.
Okay, thank you. So the last one, but not least one, actually it's very important. So from your perspective, what is your long-term vision for how countries like India can future-proof their pandemic preparedness strategies, especially with the growing influence of synthetic biology, biosafety concerns, and global collaboration? Please, anybody can jump in and start. Panel members.
Well, I'll quickly.
Yeah.
Transparency is the key. Transparency and I think transparent collaboration, and also the word ethics. We have to stress that. And ethics has to be consensuous. Without consensuousness, you cannot be ethical. I mean, consensuousness meaning the noble virtues, right? Love your neighbor, for example. Basic. If we don't have love, if we don't love each other, then we're going to be unethical for sure.
Yeah, excellent. I like so, the keywords here are, transparency and ethics. Excellent. Lema, you want to add anything?
I envision India as a regional beacon for help in pandemics from your neighbors. In the future, you have the human resources, the brain power, and the actual resources to not only be able to efficiently manage pandemics like these for the country, but also to lend help to your neighbors around you in vaccine production, and to make access to these research advancements more equitable for everyone.
Oh, excellent. Lema, I just want to add, we always help the neighboring countries or other countries. During the COVID-19, India has supplied the vaccine to a number of countries, okay? Just want to add the point. Yeah. Thank you, Lema. So, Irin, you want to add anything?
I'm going to add two words to Dr. Noel's excellent list and to what Lema also provided. I think transparency and ethics are fantastic, and thinking then about being creative and adaptable. I would add to the list, but agree with everything that my colleagues have said. Thank you.
It's perfectly fine. It's in line with the resilience, Yeah.
Exactly.
So, thank you, Irin. Dr. Himanshu, you want to add anything?
But we are following most of the things. I don't know why this is questioned. We follow ethics. We are soft-hearted. We are trying our best to cater the country, and not our country, our neighbor country. We provided the vaccine. We have a long list of whatever the panelists saying that ethics, transparency, and all those things. So we are, I think, following. I don't know why it is questioned or why it is coming in the picture. Yeah, we are like that. We support all people. We support our neighbors. We are quite transparent in our research. We publish our thing. We do not hide all those things. Any kind of research and all those things. Maybe I don't know. This is true for maybe other country, but not for us. That I want to say.
Yeah, yeah. Thank you very much, Dr. Himanshu. I just want to add, I agree with your point because, uh, India may not be the best in the world, but definitely we are moving in that direction. Okay. I just want to add that point. So, Dr. Mehendale, you want to add anything?
Yes, sir.
Yeah, please go ahead.
Uh, just one point which I think Lima mentioned about waste management. I would like to add that India does have a robust system under the Central Pollution Control Board for waste management. And we have seen the effectiveness of this during the COVID-19 pandemic also. Of course, at the same time, in addition to what Dr. Noel said, we have to invest in synthetic biology with very strict ethical oversight. Thank you.
Yeah, thank you very much, Dr. Mehendale. So, to the participants and all panel members, this one is an academic discussion and this one is a purely educational exercise. So, let's stay positive, okay? So, I wish we could have more time, but we don't. So, I would like, there are many questions I can see in chat and personal messages. So, I would like to highlight that, there are many questions from the participants. However, due to time constraints, we are unable to address all of them. I encourage participants to reach out directly to the speakers and panelists for further discussion. Okay, ladies and gentlemen, as we conclude today's session and the last session of this H5N1 360-degree webinar series, I would like to thank our all the speakers of this session and previous sessions also, and expert panelists for sharing their expertise and time with us. A special thanks to all the participants for your engagement and sharing wonderful questions, because we derive the questions based on your feedback, and we highly appreciate your active participation and thoughtful questions. Okay, so for the closing, now I pass it to our MC, Ms. Archana. Archana, over to you.
Thank you very much, Professor Bhore, for moderating this session. On behalf of organizing committee, the Center for Scientific Research and Development, People's University, and HSC International USA, first I want to thank Dr. Ashok Mehendale for enlightening and informative talk on strengthening India's H5N1 response capabilities. I thank Dr. Neo Lee Mirabia for sharing his thoughts on framework for global collaboration in pandemic preparedness. I also thank Dr. Lema V. De Haro, Dr. Himanshu Kumar, and Dr. Erin M. Sore for serving as a panel member and sharing their thoughts. Thank you, Honorable Professor Dr. Harish Rao, Vice Chancellor of People's University, for taking out time of your busy schedule to join this webinar and dialogue session. We extend our heartfelt gratitude to Honorable Dr. Megha Vijayvargiya, Trustee and Pro-Chancellor of People's University, for her unwavering support to this webinar series. Last but not least, I would also thank all the participants for various countries joining us for this webinar and dialogue session. I believe this webinar and dialogue session help you to get some insights and fresh perspectives on H5N1. Okay, ladies and gentlemen, it was a great session today. Before ending this session, we would like to hear feedback from all the participants by scanning QR code on the screen or go to the link shown below. The link is also posted in the chat box. We promise the evaluation survey will not take your more than 2 minutes. Your feedback will be greatly appreciated. I will keep this slide running for a few more minutes. Thank you everyone, and we wish you good health. I hope that everyone has given their feedback. Please note that you will receive your e-certificate within the next few days. Ladies and gentlemen, with that, I conclude this meeting and the H5N1 360-degree Connecting Global Expertise with Indian Professionals webinar series. Once again, thank you all for your active participation and for contributing to the success of H5N1 360-degree webinar series. Thank you. Namaste.